This is Sally. After acquiring chronic kidney disease at 63, Sally has been performing peritoneal dialysis for the last 2.5 years. Sally is preparing for her nightly session of peritoneal dialysis. Per usual, Sally turns on the dialysis cycler, hangs the dialysis and drainage bags, and connects the catheter to the lumen in her abdomen. Dialysis is the removal of waste products that the kidney would usually filter from the blood using a dialyzer. Hemodialysis is a type of dialysis in which blood is drawn and cycled through a dialyzer. This is usually done through a fistula. Hemodialysis is done at a facility 3 times a week and usually takes multiple hours. This contrasts with peritoneal dialysis. Peritoneal dialysis, or PD, is an at-home method that uses the patient's own peritoneum. A dialysis solution drains into the patient's peritoneum, where it dwells for 20 to 30 minutes before draining into a drainage bag. While it dwells, the peritoneum works as a natural exchange barrier for ions and wastes. PD frees patients from multi-weekly dialysis center visits while also providing gentle, daily body filtration. Over 26,000 patients in the U.S. alone use PD. However, there's a high risk of infection at the opening of the PD catheter site. Infection of the peritoneum, known as peritonitis, can eventually cause scarring of the peritoneum if the infection is not quickly treated. While severe peritoneal scarring will prevent the peritoneum from acting as an efficient exchange barrier, making PD impossible and limiting the patient to HD. PD can last up to 10 years, but due to infection, patients switch to HD only after 2 or 3 years. Currently, the main preventative measure for infection is patient sanitation and compliance. Once there's an infection, it may take 1 week for visual cues of infection to occur, including flu-like symptoms or discoloration of the dialysate. The patient then sends in a sample of the drainage fluid to their physician to perform a culture, which could take another week. This lengthy process contributes to the scarring of the peritoneum. We are Team JAMM, and we want to design a way to detect preclinical peritonitis for patients who are using PD in order to treat the infection earlier and prevent scarring of the peritoneum so that PD can continue to be utilized.